This is case of the day, and I'm Bhavin Jankaria, and we have the 103rd case, and today is Tuesday, and we're going to talk about a wedge-shaped focus in the pediatric femoral head. So this 12-year-old had right hip pain and came for an opinion this morning. There were only films, no soft copy images, so we actually had to struggle a lot to get the right quality of images for the presentation. But here are the images. So this was in November 24, and we can see that there is already a diffuse reduction in the hip joint space, a little bit of osteopenia. No osteolysis, no bone destruction. The left hip is normal, the SI joints are normal. An MRI was done, reported as an infective arthritis, but there are these wedge-shaped areas of altered signal in the femoral head, not very well seen on the stir, and some corresponding marrow edema in the acetabulum. No erosions, no osteolysis, mild effusion, everything else normal, no enthesiopathy. So that's the wedge-shaped area, which really is the clue to the diagnosis. But the arthropathy gradually progressed, and the patient was put on anti-tuberculosis treatment. On treatment, this has been the progression. So this is Jan 25, June 25, and September 25. By September 25, that is about a week ago, there is virtually complete cartilage loss, though there is no ankylosis. I mean, there's fibrous ankylosis, but no osseous bridging. There are secondary osteophytes here, and there is osteopenia all along the right side. So an MR was also done about 10 days ago and shows the diffuse cartilage loss, some mild effusion, osteophytes. You actually see uh, a low signal in the central femoral head, again wedge-shaped on the stir, and there's premature physeal fusion. So the summary would be progressive unilateral arthropathy without erosions, osteolysis, collections, and no other arthropathy elsewhere, no constitutional symptoms, with a wedge-shaped focus of marrow change on the first MR in the femoral head. And this is characteristic of idiopathic chondrolysis of the hip. Multiple papers, this one's the latest, published very recently, and it just puts together all the evidence so far. So for those of you who are interested in reading about the entity and the management aspects, that's a good paper. It's freely downloadable, and it mentions all of these things, that it's acute and rapid progression of hip cartilage destruction, typically in prepubescent children. There's pain and limitation of motion, and the reason is an unidentified immune reaction. So we don't really know much about it. We don't know why it occurs. We don't know why it occurs more on the right than the left. We don't know why it occurs more in women than men. But we do know to some extent how to recognize it. There's also a paper by Amarnath, who's been our past president, and this was an interesting paper because now it gets cited for the staging, and the staging was a radiologic or an MR staging where stage 1 is where you see the wedge-shaped area only in the femoral head, perhaps with effusion. Stage 2, that is in our patient, you also see acetabular edema and start seeing cartilage loss. And then stage 3 is when there is full blown loss of cartilage and degenerative change. So I went through my archives very quickly, and we have about 10 odd patients over the last 15-20 years that I've identified, and my team has identified. This was a 7-year-old girl with a wedge shaped focus here. This is a 14-year-old boy with a characteristic appearance, and these are all idiopathic chondrolysis. Why does this occur? We don't know. But this paper, Manisha is in this paper from All India Institute. Manisha is a pediatric radiologist and very well known in the country. So they say that the possible reason for the central wedge-shaped signal is not known, but may be due to a disrupted vascular supply in the watershed territory between these two vessels that I've mentioned here. So the standard differentials would be anything that causes a monoarticular progressive arthropathy. So infection, Perthes, slip capital femoral epiphysis, undiagnosed. So these can then lead to an arthropathy. Transient synovitis usually is not an issue. Adolescent inflammatory arthropathies, juvenile rheumatoid arthritis, juvenile axial spondyloarthritis, etc. But there's one condition that is often missed. And I'd done this case up at bstneoplasms.com of this patient who had knee pain. Then they found that it was because of the hip, and there is this diffuse reduction in joint space. Uh, Not rapidly progressive, but the patient was symptomatic for 15 months with some effusion. And there was this little focal area of altered signal, which then on a CT scan turned out to be an intracapsular austere osteoma, which is known to create confusion in these situations. So, to summarize, idiopathic condylosis of the hip is uncommon, but can be diagnosed in the presence of a typical wedge-shaped central altered signal focus in the femoral head with progressive arthropathy. That's the seminar, my WhatsApp channel. Thank you so much for viewing this.